Welcome to KLR Medical Certification Training School, where we're all about building skills, careers, and futures.
Today we're going to do a little pharmacy fact or fiction. Think you know about pharmacy? Think again.
Mr. Grisham, do pharmacy technicians just count pills?
Well, that's not the only thing they do. We do a lot of things in pharmacy. One, we prepare and compound medications. Compounding means we take more than one ingredient, we mix it together to make a brand new medication for a patient, which is pretty cool. We process insurance claims and patient records. So we deal with what we call third-party payers. We work with different insurance companies to make sure their insurance provides coverage for the patient that we're working with. So that's very, very important to make sure they get the right medication. We measure and calculate dosages. So I hope you like a little bit of math if you're a pharmacy tech. We have to make sure that we are calculating how much medication the doctor wants for the patient to make sure that medication will last through the entire period. So if they say they need this medication for the last 10 days, we got to make sure we dispense that amount. Managing inventory. We count, we receive different medications throughout the day and throughout the week, and sometimes we have to count those to make sure our inventories are accurate, especially a controlled substance. Like a Schedule II medication, we have to count those more frequently because the DEA might come in and audit us, and we have to make sure those medication quantities are exact numbers. Assist patients and healthcare providers. So if you're more of a face-to-face person and you want to do a lot of talking, figure out about that person's day, everyday life, you might want to work in a retail setting so you can have those day-to-day conversations, interactions with patients. If you prefer a doctor's office or a hospital setting, you might not have as many face-to-faces, but you'll be dealing with different nurses, different doctors. So if that's more of your cup of tea, that would be the way to go.
Is a pharmacy technician a dead-end job?
Definitely not a dead-end job. There's a lot of different things we can do as a pharmacy tech. There's a lot of career growth opportunities. We'll talk about that in a second. There's a strong job outlook and demand. Currently, until the year 2034 is about a 6% increase in the demand for a pharmacy tech. And if you're talking to our local pharmacies that we partner with here in Indiana and throughout some other states as well, it's a lot higher than that. They're always hiring, always looking for good people to hire, especially out of our CTE programs, our high school program. They're looking to hire those students directly from high school. So really, really strong opportunity and demand. It's a great pathway in other healthcare careers. So if you are a pharmacy tech, you can move that into a pharmacist. You can go into a nursing or a doctorate, and you can always use pharmacy tech because you have to learn about the top 200 drugs, how they affect people, how they work in people's bodies. You can apply that to any other health career out there. So pharmacy tech is awesome. And then meaningful hands-on patient impact. Not only you're handing people medication, you're just learning about how their everyday life is, you're getting to know them, you're making their life better. In a lot of instances, a lot of these medications are life-saving, and you get to have those interactions with those patients and see how happy they are that you're helping them through a tough time in their life. And then our continuing education and specializations we're going to talk about on the next screen.
Check out all these options.
Oof, that's a big list. So here's some different things you can roll into. They have advanced certified pharmacy technicians, so even further along than our CPHT certification that we teach here at KLR. We have certified compound sterile preparations tech. So if you want to work with those IV medications, those life-saving medications that you see in a hospital setting, you want to get certified with a compounding sterile prep. Billing and reimbursement, if you like more of the insurance side of it. So if you like just jumping on a phone call and having conversations with insurance companies, that might be something you'd look into. We have controlled substances diversion prevention certificate. That's to make sure those controlled substances are staying in the pharmacy and only being used for the patients that actually require them and no one's abusing them. So that's a certification that you guys can pick up if that's something more of your cup of tea. Think loss prevention. Hazardous drug management certificate. Immunization administration certificate. So if you like dealing with needles and injecting medications into people's bodies, that's something that doesn't like scare you. That's a great thing that you can get a certificate in, and all these certificates such as that one will help you get extra money, and we all like a little extra cashola. Medication history certificate, medication therapy management certificate. That's like collecting that data for the pharmacist so they can help make a informed decision on patients' medications. Non-sterile compounding, so that's just like our compounding previously, but not as sterile environment. So that might be making a medication that you can make in a normal everyday pharmacy for a patient. It doesn't have to be strictly sterile. We have point of care testing certificate, regulatory compliance certificate. So that's that rules and regulations that we talk about in pharmacy tech. So if that's your thing, you like that law side of it, that's another certificate you guys can get. Supply chain and inventory management certificate. If you just enjoy ordering that medication, dealing with those suppliers to bring that medication into a pharmacy, that's another great certification that you guys can get. And then technician product verification certificate. So many different options out there. Most definitely not a dead-end job. I highly recommend being a pharmacy technician.
Can anyone become a pharmacy technician?
Yes and no. It doesn't require a college degree, but you do need a high school diploma to start with. It does require a background check. Those background checks are because we're dealing with those controlled substances and medications that could cause someone to want to make a bad life decision and possibly sell those illegally. So we'd have to run that background check on you to make sure that you don't have anything like that in your history. However, nobody's perfect. If you've made mistakes in the past, as long as we can fill out the proper paperwork and we supply that to the State Board of Pharmacy, usually there's a way around that, so don't let that get you down. If you've made a mistake, we can work through that. State requirements. Mrs. Grisham, we just dealt with the state of Oregon, I believe. It had some extra state requirements. Can you tell that about us?
We did. So Oregon requires a photo ID, a 2x2 passport style photo, a moral turpitude statement, your NHA certificate, your birth certificate, and they want your back of your driver's license and your application.
Okay, so that's a lot. Some states just require you have a pulse and you can be a pharmacy tech. Not in the state of Oregon. So each state has a little bit different requirements. So it just depends on the state that you're living in currently, and we'll help you through that. Mrs. Grisham did mention the NHA national certification that we're going to help you guys get. So that is one requirement for the State Board of Pharmacy in most states. You require that NHA certification to get your state license. We're going to help you through that. That certification will follow you anywhere in the country that you move to. So you move from state to state, that certification will follow you. You just have to keep it active with your CTE and keep that renewed every 2 years, and you will have that certification for life, and that certification helps you get more money. We like that, don't we?
So, Mr. Grisham, is there a difference between a pharmacist and a pharmacy technician?
Yeah, there sure is. The pharmacist is the boss. Pharmacy techs, we just help the pharmacist. Pharmacists are required to have a college degree with up to 8 years of education, along with passing 2 major exams, much harder exams than our CPHT certification through the NHA. And on top of that, they have to have enough internship hours before they're allowed to run their own pharmacy. So they have to work under a current pharmacist just to make sure that pharmacist thinks they're able to run a pharmacy, because they're the ones that check our work as a pharmacy tech. So they have to make sure they know what they're doing. They also have to require counseling to patients. So if people have questions about the use of their medications, about potential adverse effects, that's where the pharmacist steps in. They are the boss. They know everything about the pharmacy. If you guys ever have any questions, do not be afraid to ask them. They are happy to help you in any way possible. All right, now we're gonna move into a section we call Fact or Cap. What's the first one, Mrs. Grisham?
Coca-Cola was invented by a pharmacist.
By a pharmacist? That's a fact. John Pemberton, a pharmacist from Georgia, invented the Coca-Cola formula, the original Coca-Cola formula, but it was actually made with cocaine. No wonder it was so addictive. Why? Because it's a Schedule II medication. Schedule II means it's highly addictive, but nowadays we only use cocaine for Schedule II medications. So in some surgeries, they still use that cocaine because it's a very good natural numbing agent, and it's a vasoconstrictor, which means it prevents bleeding. So during facial surgeries, they're going to use some cocaine. That's Schedule II. But what's pretty cool, a pharmacist made the original Coca-Cola formula. It's still going strong today, minus the cocaine. And also, as a pharmacists have developed bubblegum, Pepsi, and Dr. Pepper. So they really dig making sodas. So if you're into compounding, you might have some little extra green coming your way if you know how to invent the next cool soda. Fact or cap?
Some pharmacists work in space programs.
That seems a little out there, like outer space out there, but that's a fact. NASA employs pharmacists to support astronauts' medication needs. So that's pretty cool. Who would have thought that you could work for NASA as a pharmacist? So hey, start as a pharmacy tech, work your way up, get that education, become a pharmacist. You might just work for NASA. Fact or cap?
If you don't like this video, we won't get paid.
Ooh, our boss is actually pretty cool. She wouldn't do that to us. However, thanks for joining us today. If you found this video helpful, don't forget to like, subscribe, and share it with someone who could benefit. Stay motivated, keep learning, and remember, you can do hard things. We'll see you in the next video.